Afternoon, Annette Rodriguez, Public Health Director. COVID-19 cases continue to increase rapidly in Nueces County. The week ending of June 19th, we had 212 cases. This past week, ending in June 26th, we had almost 1,000 cases. To be exact, 951 cases. That's 5 times the number of positive cases from the previous week. This exponential growth is disconcerting to those of us in our community, but also to those in the surrounding towns, as well as in Texas and across the whole United States. As our number of positive COVID cases increases rapidly, so do our number of hospitalizations. And when hospitalizations increase, it is inevitable that deaths too will increase. As you've heard, we had 2 additional deaths over the weekend. These individuals, while both hospitalized, were both male patients. One was in his 70s and one was in his 50s. These individuals also had comorbidities, like many individuals in our population do have. But only God knows if they had not contracted COVID-19, would they still be with us here today. Our sincerest condolences go out to their families and to their friends. The rate of spread is alarming and must be curtailed, but there are simple things that we can do to decrease the spread of the virus. So first, stay at home. If you are a vulnerable population, take this time to stay indoors. Stay at home, have family come and drop off groceries for you. Utilize your grandkids to help you do those things. This is a good time to have family help you. Stay at home. That's how you are going to protect yourself. Number 2, stay distanced from strangers. 6 feet is great. 10 feet is better. 15, 20 feet is even better than 6. Stay distanced from strangers. You say, well, I know those individuals. Can I go and speak to them? If they are not part of your household, the answer is no. Stay distanced. You don't know if they have the virus or they're carriers, and you definitely don't want to spread that to them. The third one is stay protected. Wear a mask. Cover your nose and mouth when you're out in the community. You do not want to spread a virus. Hopefully you don't have it, but you don't know that until you actually have the virus. And you actually don't want to pick up the virus from respiratory droplets either. So wear your mask whenever you're outside of your home. The number of coronavirus cases will continue to rise if the whole community does not do their part. This message is specifically for the young, 25 years of age and younger. You are correct in thinking that if I get coronavirus, I may not be very sick. That's correct. But you do spread the virus, and you could actually spread it to somebody that's vulnerable, that ends up hospitalized, and even ends up in critical condition. We are all certain that our young population is not intentionally wanting to get anybody sick, but our young population also needs to do their part and be responsible and be righteous. I believe in them, and I hope you too encourage them to practice safe behaviors. If you are found to have COVID-19, stay in isolation for 14 days. That is required. Isolation is required for anyone that tests positive for 14 days. Quarantine, on the other hand, is for those individuals that come in contact with the positive case. If you're found to be COVID-19 positive, you must notify your employer, your coworkers, and your friends that you are positive with the virus so that they may quarantine themselves. You are required to self-isolate for 14 days, but they are required to quarantine themselves for 14 days. If you are in contact to a positive case, you must quarantine. That means that those tested positive must be quarantined for the 2 full weeks, even if you are not sick. We have many people that say, I don't need to be quarantined. Yes, I was in contact with the COVID-19 positive, but I do not need to be quarantined because I'm not sick. That is the incubation period that you're in. The incubation period is a 2 to 14 day window that when you were with somebody that now they have COVID-19, Those 2 to 14-day time period is the time period when you can actually pick up this virus. So that's the time period that we require that you stay in quarantine. What is quarantine? I'm in my house, I'm staying here, I'm making sure that I'm not around anybody, I'm not going out, I'm not going to the middle of the grocery stores, I'm not doing anything where people are inviting me to their homes, to parties. I'm staying at home and I'm quarantining myself from those individuals. COVID-19 may cause severe inflammation inside of some individuals, while others may only have a mild respiratory symptom. They might just have something that feels like a cold. The problem is that we don't know who is going to get which one. And so everybody needs to protect themselves from this virus. But what we do know is that the vulnerable populations, and these are individuals that are diabetic, these are individuals with dementia, with asthma, with chronic obstructive pulmonary disease, or even those that battle being overweight, have more severe bouts with this coronavirus. If you and your contacts will all do the right thing and stay isolated and quarantined for the required time period, this virus will not continue to spread as rapidly as we are seeing it currently being spread. Finally, together, all of us, practicing responsible behaviors such as washing our hands often for 20 seconds at least. Also, social distancing from strangers, staying at home if at all possible, not touching our eyes, nose, and mouth with dirty hands so as not to infect ourselves. Practicing good hygienic and respiratory practices will help navigate us all out of this COVID-19 pandemic. Stay healthy, stay protected, and as always, stay informed. Thank you.